Director at the Noguchi Memorial Institute for Medical Research, Professor Dorothy Yeboah-Menu says the institute has been the lead and height of the COVID-19 pandemic since Ghana recorded its first case. According to her, the institute has equipped other laboratories across the country to fight diseases as monkeypox to ensure that such infections are properly controlled and managed.
According to the director of Noguchi Memorial Institute for Medical Research, Professor Dorothy Yeboah-Menu, the institute has been at the forefront of tackling the COVID-19 pandemic. Notable examples, according to her, are Ebola disease outbreak in 2014, the H1N1 influenza in 2009 and 2017, the H5N1 outbreak in 2018. She said the swift response to the national call led to the rapid detection of the recent Marburg outbreak, leading to the institution of the appropriate interventions, dampening an otherwise disastrous event.
Meeting, what we seek to achieve is that we want to show the general public some of our findings during the COVID and recent outbreaks such as Marburg and the yellow fever outbreak, the influenza recent outbreak. We want to share also the ongoing monkeypox outbreak. These are events that we need to discuss that will direct our directions how as a country we will position ourselves in future outbreaks. What Noguchi Memorial Institute, the leading biomedical research in country, is doing, and even in the area of drug discovery, what we are doing, and that's what we seek to engaging them and even co-creating some of the solutions. And recently what is now we are doing is that some of the diseases endemic areas, we go there, we have the social science research are organized in a multidisciplinary manner. So we are with the social scientists, the health system experts, the basic science, all these together, and we are now trying to communicate better. Some of the words that we say, how do we break down to the ordinary Ghanaian to understand?
On his part, the presidential coordinator for Ghana's COVID-19 response, Dr. Anefi Asamoah, outlined what goes into research and also recommended some solutions to help have better scientific research.
Researchers, we need to also get interested and have a richer understanding of the policy-making process. The need to engage policymakers. Fortunately, policymakers are not completely naive when it comes to research. They do appreciate research, but they do not always appreciate that research takes time. They don't understand, they think research doesn't cost money, and they don't know or don't appreciate that research requires proud investment. Someone said, in general, policymakers tend to treat research as the drunkard treats the lamppost. Not for illumination, but for support. So, policymakers support their conviction. So they understand research, but their perspective to research is different. And that is why we need to engage them.